So thank you guys for coming to see this launching event. We're launching this educational materials for planetary health to health education. So as you have seen, it's called, where's the pointer? Is there a pointer? Okay, but it's not actually, oh, no, it was. It's called Patient and Clinic Through the Lens of Planetary Health. And there's volume 1 and 2. Volume 1 is a learning guide for an undergraduate health education. So it's meant more to undergraduate health education. And the second one is clinical cases for educational activities. This you can use with undergraduates and also with residency students or even people that are working, professionals of health professionals. First of all, have a look at the globe that the scheme we developed. So it has planetary health elements on it, and it gives an idea of what we want to bring. That is this interconnections and dependability. Here are what means each illustrative, each element that was in that globe. So planetary health elements. Here are the authors. So I am Rafaela Zandavalli. I am a family doctor. I work in a healthcare unit in Porto Alegre in Brazil, south of Brazil. And I am a master's student also. And this is one of my master's work. I did it with great help of my advisor, that Tatiana is here. She's an education fellow in PHA. With Enrique, also here, a family doctor, and eating out, yeah. Also with the help of Mayara Floss, Karina Pavão, and Ellen Abelson, and collaboration of people who helped to do the diagramming also. So Tatiana, Monica, and Ana Luisa, also the translation to English. It was first written in Portuguese, because we used it, and I'm going to show you some photos of us using it in universities in Brazil. So the background was the planetary health education. We incorporated all the elements that are told that are important to when you educate planetary health. And we used the actor network theory that is from Bruno Latour. He's a French philosopher, anthropologist, and sociologist. He's very influential in these areas, and he talks a lot about Gaia, the Anthropocene, and nature. We use lots of elements of his work, and especially one called the actor network theory that connects human and non-human actors that we use especially to the system thinking and complexity component. So the objective of this work is to provide research-tested planetary health educational materials for teachers and students, and an innovative hands-on method of system thinking and complexity using the actor network theory. So volume 1 and volume 2, what's the difference? The targeted audience is a little different, I have mentioned before. Volume 1 is for undergraduate healthcare professors and students, and volume 2 for undergraduate, graduate, medical, multi-professional residency, and graduated health professions, also for teachers or students who want to use them. Volume 1, also a big difference, is volume 1 stimulates students to talk to real patients, and volume 2, we have 8 cases, written cases, so already done. And the contents also are a little bit different. Volume 2 has the cases and suggested references, and Volume 1 has a suggested lesson plan, a pre-class material, a portfolio that students have to answer, a sample portfolio for teachers, an interconnection within nature activities, suggestions, what you can do, and study references for students. And we have implemented both methodologies. So Volume 1 we have implemented with, this is actually my master's work, this implementation of Volume 1 in the university in Brazil with 43 medical undergraduate students. And Volume 2 we have implemented it in two universities, a few cruise projects that is involved, more 2 universities, with residents of family medicine and multi-professional residency also, and with doctors in Family Medicine Congress in Brazil. I'm going to show you some photos of what happened as the sequence goes up. So Volume 1, I have explained to you what it contains, what it has inside. So the suggestion lesson plan to use it, pre-class material that is introductory text and videos, which we gave to students to read and start learning about planetary health. The portfolio is what, with suggestion of students to what to ask for the patients, and then afterwards they had to do this activity and hand in for the teachers. We did a group activity. Students made it in little groups. And they had to do also a net diagram that I'm going to explain to you what it is. It is the actor network theory put in practice. So suggested possible answers for teachers so they could correct, and they don't need to be experts in planetary health. They can use this to guide. And the study references. So this was the implementation of Volume 1 in the second semester of 2022 with 43 medical undergraduate students, and 7 teachers were involved in a discipline that is an integrative discipline in the curriculum. We did quantitative and qualitative analysis, and students interviewed inpatients in the university hospital. And these are some photos of the professors. So students received, teachers received the student suggestion lesson plan. Students received the pre-class material, the portfolio, and study references. And teachers received the sample portfolio for teachers. All of this is chapters of Volume 1. You can find all of them. So here's some examples of what students did using the actor network theory. They interviewed the patient, put their name in the center, and all elements of the disease of the patient, or family elements, social elements, environmental elements that came in, psychological elements, and also using keywords of planetary health that we asked them to use. So they had to connect with air pollution, with heat stress, with mental health, deforestation. It was, I think, in total like 10 words, planetary health words they had to connect. So another example of the work students did here. And they did an interconnection within nature activity also at the university garden. We spread signs hung in trees of the garden, and to simulate their reflection about the interconnection within nature. Also, you will find this in detail in Volume 1. And preliminary results, quantitative analysis, showed that students, they had an improve in the impact that they thought that environmental changes had on patients' health. Also, on the question of how interconnected do you feel with the environment, and how important do you think it is for physicians to apply planetary health. They also improved the knowledge of planetary health related diseases. So first, you can see the blue graphic inside, and after the red sign. So they pointed out that more diseases where they saw relationship with planetary health, with the environment. And some preliminary results of qualitative analysis. I haven't done them yet. I just selected some phrases of students to show you. They said it was nice because students were protagonists of the learning process, that the portfolio and the group presentations were productive, that they liked the suggested references, that they see in their professional practice that they can be part as a health professional in developing a healthy environment. They can see the patient now as part of a larger whole. They can connect the context of life and illnesses that is more interconnected than he thought. And said it was innovative, and one thanked for the opportunity. So now volume 2 is the cases. I have 8 cases. Well, case 1 and 2 are in detail explained and with the answers. And the other cases are ready to use, but aren't with the answers. So this is the example of one case. You can find it on volume 2. You can actually get who has come in now. There is bookmarkers at the entrance with QR codes. Okay, so after you can get it, and you will find, volume 1 and 2 there to download. So it has references for the students to answer the case. This is an example of a net diagram. This is how we use the Padlet resource to do it online, and we have also done this in person. Yesterday we did a workshop using, you can see there in this table are the posters of the workshop that everyone who participated did yesterday. Yeah, please show them. But also we have done it several times online, and it works very well. So we simulate also that students do an individual approach and a collective or community approach suggested related to that case. Here's some examples of using the volume 2. So another university at Brazil with students, medical students, 52nd year medical students. Some examples of the posters they did, doing the network diagram. Here we used 5 different cases, and afterwards students presented one to each other. Doing a workshop with residents of 15 multi-professional residency and family and community medicine residency programs. Also some posters that they developed using the cases. So the potentialities of this education material is that it stimulates integrality and complexity thinking, individual and community approaches. In the portfolio, we have basic questions like relating the pathology, the pathophysiology of that disease to planetary health. We have these types of questions, and also questions about clinical knowledge. Has different possibilities of insertion in the medical curriculum. So you can use clinical cases that are ready, or we have a method to use with real patients that it can be very exciting, because we'll find different answers in different places around the world, and with each person, you can do it in extended number of lessons, or just 2 lessons with the material that has there. You can. So it has different possibilities of insertion in the medical curriculum, and it proposes some interconnection within nature activities, and has diversified forms of accessible study references. I took really care in selecting the references so that it could be accessible and palatable for students. And and teachers do not need to be planetary health experts. They can find a lot of supports with the answers on this material. So thank you very much. I would like to talk with you and know where you're interested in planetary health education. Now, just so you know, also the QR code for downloading the materials, the book 1 and 2, is at the top. Then we did a planetary health education blog. It's not completely ready, but you can access it. It's meant for you to, if you use a clinical case or if you write a clinical case of inspired in the place that you live in, the problems that exist in the place that you live in, you can share it there. So we can make a place to expand this, you know, and can share photos of the activities you did with students also. That this is meant for, the blog is meant for this. And to share the activity, you can share it with the third QR code. Or there's the link of the blog, and the way to share it is in volume 1 and 2 also. We'll find it there. And this is my email. So I'm just going to go back to the slide when it shows the differences of volume 1 and 2 for people who are listening to us online. And now we're going to be able to talk here in person. Yeah. Could you now, can anyone say what's their name, where they come from, and why are they looking forward to getting resources to teach planetary health?
Thank you so much. That was very, very interesting and very exciting as well. My name is Iris. I am a medical doctor from the Netherlands, graduated a year ago, currently doing a PhD in London. And actually, during my medical studies, I worked for many, many years to get planetary health education into our curriculum. It took me a long time, but finally succeeded. So now we have a couple of hours of mandatory planetary health education for all medical students at the University of Amsterdam. But I would be really curious to learn from you. I was so amazed by the methodologies that you used, but I would be really curious to learn the implementation process. How did you get support from the universities for this, and also maybe the funding and all that? If you could speak on that, that would be great as well.
Okay, so this has been, we are developing this since 2021, I think. Actually before, because my professor and also Enrique have been thinking about this method of using the actor network theory and implementing it on planetary health. Let me see. It was a staircase. In the university that I implemented volume 1, that is my master's work, it's the university I studied, so I had contact with teachers there, family doctors teachers, and they teach this discipline called integrative discipline, that it integrates clinical knowledge and basic knowledge. And they use this portfolio. They already used this scheme of portfolio, but I transformed it to a planetary health portfolio. And they were very supportive. I think it was a little... some teachers thought there are 7 teachers of this discipline, of this course. Some thought it wasn't very adequate at first, but then I showed them the possibilities, and at final they thought it was very nice. And so I did contact with people I already had some acquaintance. Yeah, and the other ones that I showed, that we used clinical cases, those 5 clinical cases. He's the other teacher. How do you say orientador in English? Do you know? Advisor. Yeah. So she's my first advisor, and the other professor that is in the other university is my second advisor, and he teaches one course there, so it was easy, and he likes this team. So we have implemented it in these 2 universities, and 1/3 that is Professor Karina, another university in another city of Brazil, and she thinks it's very important. And actually, this was the first in 2021, the first time we used one of the cases and used the methodology, and it came from her, this demand, and we have this planetary group of Brazilian people, of Brazilian scientists, and we got to know her there. And the other question was funding. You asked for funding. We don't have any funding, so we used our resources to print the things we printed here, and so we had an excellent help of Telesaúde. You know Telesaúde? They have a planetary health course. That is, Planetary Health Alliance has supported also this course. So they are a thing linked to the university also. They gave us the space to publish it. So you're entering the Telesaúde website when you go into the carry code. We had this help from them. Yeah, Tati.
I just like to add more two points about this. The first one is that in Brazil, the curricular changes, it's difficult. The universities are so traditional. So we, Planetary Health Group, that we are working with curricular changes, we see that we should go through 2 ways. A way of making presentations and conversations and advocacy with the boards and with the government panel of orientations for curriculum, because most of the universities that we work are public universities. And this is a difference about Brazilian universities. Those are public universities. So the government has basic orientations of what the curricular should be for in which course. So this is a way that we are going, but this is slow. This is slow because it needs it needs to change also the persons that are in political yeah, and I believe that all know in Brazil we had a government and we already are in this government that are not so in love with planetary health, I would say. Fortunately, this will change in the next year. So this big one is something that is a political approach, a political lobby. It's a kind of advisory. So in this scenario, we choose to go from the button. So we start to talk with our colleagues, our teacher colleagues, that they have the space and the freedom to construct their own curricula in their own courses. So that's the way that we are spreading. So we are spreading, and in 2 years we have a great spreading in universities in Brazil, but they are not officially in the curricular. They are in the planned courses, the schedules of the teachers. So that's the way we are going. And yeah, just the second point is about funding. We are not funding to print, but all that we do is in public universities. So the teachers, the spaces, the students. So yeah, this is a difference.
So I thought of your question about implementation, and maybe your starting focus was, okay, it's ready, how do you implement it in the university? But I was just thinking, well, it's a good question. When did we start? And so I think that we had a very good relationship with the professors of family medicine, because a lot of work went there before. And it started way back when we started working within the World Organization of Family Doctors, which was founded by Dr. Allen, which is one of the co-author, and Andy Haynes, which is was the chair of the Lancet report on planetary health. So it gave a lot of scientific legitimacy to show that we're not just tree huggers. Okay, so I think that's a very important issue for implementing, showing that we have really robust science and evidence-based medicine. I'm talking about med school, which is where I work. So then, from that legitimate space, from the scientific narratives for family doctors, we were able to introduce it in Brazilian conferences. And we had to test this methodology and reiterate it. And Tatiana and we brought this methodology to Stanford meeting. I don't know if you were there. We presented it and we discussed. And so it's a very long process. And then we were able to create the first World Conference of Planetary Health for family doctors, which was in Brazil, virtually, but in Brazil. So again, that gave a lot of legitimacy and a lot of visibility, and of course Andy Haynes opened the conference. So, and now we even have one of the most important general medicine books has a chapter on planetary health, which is, again, written by Andy Haynes. I'm one of the co-authors. So I think that's one important thing, to make sure that you have the science, that you know how to communicate, and that you know how to make alliances with partners that may be interested. So this is, a lot of it has a formal space, which is peer-reviewed journals, but then there's a lot of informal stuff. And the way we introduced it in the university was very informal. I introduced this in my university a little bit before, and it was very informal, like, okay, just do it. And you have to be with that kind of spirit still, because sometimes I feel we don't really know, and I'm trying to advance this, we don't really know what planetary health is. And I think this is one of the advantages, because we can be creative and learn together and create it.
And fortunately, yeah, I'm going to pass. Fortunately, we have managed to this is going to go on, in this university that we did. It's not going to be just one first. We hope, because this depends upon the teachers that are teaching those courses.
My name is Asad. I'm a PhD research fellow at University of Oslo. So my question is this is target audience. I see undergraduate, graduate, medical, and multi-professional residency. So how do you manage the same curriculum for all these group of people, because their understanding may be different? And the other thing is, in Brazil, I don't know about the education system. In Brazil, how the medical education is regulated. For example, in South Asia, it is regulated by a central body, and all same curriculum in all medical school. So the same thing is studied all medical schools. So it is little bit tough to change, because it requires huge change in the policy level. In Brazil, is it something like the each public university can introduce new courses by their own decision, like by their academic board, or it's also there is a governing body in the national level?
I will start by answering the last one. Yes, there is, in Brazil, we have official governmental orientation for the med curriculum, but they don't establish the exact course and what will teach it in each course. So they establish that medical curriculum should cover this, and this disciplines. So each university will adapt to this to their context, because inclusive Brazil is such a big country. We have challenges that are so different in the south from the north. So it's important to have this space in the curricula to have this adaptation. So there is an official orientation, a document there that establishes what should go, but it's general, and each universities will adapt. So what I see for Brazil is that we need to put some kind of mention about planetary health in this general orientation. Yes, it's a way, but we need also make the advocacy in our universities to make this flow within the courses, because in my experience as teacher, putting a mention of a concept in a general orientation doesn't guarantee that this will be good teaching to the students. So what we are main worried about is how to teach this extremely good to the students, understand this as a practical tool, a clinical tool that they will use in all the cases and all the days as doctors. So this is the movement, as making this curricular advocacy at the documented level, but also making this materials and this local advocacy in each university.
Yeah. Can I answer like his first question first?
I don't know who.
I'm going to use this, put it there, because I need to show the PowerPoint. So let me show you. Volume 2 here. So we have these cases, and it covers a lot of aspects of planetary health. I didn't say this before, but air pollution, biodiversity loss, mental health, endemic of obesity, undernutrition, and climate change, heat stress, inequity, environmental racism, water pollution, indigenous health, environmental footprint, and the healthcare system, promotion of change, and infectious diseases. The case cover big aspects of planetary health. And so the case is not very big. It's a small case, but with lots of elements there. And we have suggested main references for study related to the case. In volume 1, there, as I had mentioned before, there we did very accessible and palatable references for anyone for students, you know. So it's not meant to be very difficult. It's meant to be a pleasant way to learn planetary health. And with the references, pleasant references, like short videos, and also there are more complementary references with articles, more dense articles. So the way you use it, you can adapt it to different publics. And if you are going to do an extended number of lessons, you can deeper it more. Like you can, and if you're going to do just a workshop, 2 hours workshop, maybe you can pass a video, a lesson about planetary health that you create, or it is an example of one that I did and I passed in one of the one case. We had 2 hours with students and to do this hands-on methodology. And before I sent them a 1 hour lesson that I approached planetary health more superficially, but saying everything about it. And they were able to do the cases, to do the links. And after we discussed each case and learned more with the discussions. So you can adapt with the time you have and the kind of public you have.
Can I? Okay. Yes, I am Keiko from Tokyo. Congratulations and thank you very much for sharing this and wonderful materials, and also very well organized. And so I think it is very important you have references in the cases. I definitely agreed. So this process is very important to have this materials, and then to try to include the medical curriculum. Although you have challenges, and also other places and a lot of challenges in medical education. Then in addition to that, yeah, so planetary health itself is multidisciplinary, transdisciplinary, and transdisciplinary thinking is definitely necessary. And then, the already seniors, so those grow up the silos, and so the way of thinking transdisciplinary, so we are trying to do. But for the education to the young, so the undergraduate, so opportunity for them to think together with other disciplines is, I think, critically important. But I think, and I know that, so the curriculum issue exists. However, so if for the medical students have this class, then out of curriculum activities, why don't they have yes, with students from agriculture, students from environment science and climate science, or even the engineering, so they would be much more creative, and then also so there was a new way of thinking comes. So the official curriculum, including in the official program, is definitely necessary. And then, so we know in the health sectors, maybe even within health sector, the nurses, medical doctors, and rehab. So first they have to, they learned separately, but now we have a lot some joint studies partly included. Like that, planetary health itself should push much more multi-sectoral learning as a must in the education curriculum across not only medical education, so all sectors. Yes, but I think but there is a type. So if there are something happening in Brazil or other places, I'm happy to. And then of course in Japan Japan also we are trying to do that. And then one of the university have started to so all students. So also not med, but engineering, and then even the philosophy or the literatures. Anyway, they have the classes like that, and then it just started from one university. But I hope so our group want to spread that. So I think there are various ways to include the education system. It depends on the individual countries and the context. Yeah.
Just really quick, it's interesting you mentioned engineering. So Bruno Latour, that was the picture, he actually created this model for complex thinking in an engineering school in France. So it works for medical doctors, it worked for engineers. So this is a good model to be incorporated as a robust way of graphically registering the complexity in systems thinking that we could use across, I think, all disciplines. And it's not that hard, and it can be fun. So that's one of the lessons from our work, I think.
I had some things to say also, but I'll let her speak first.
Hi, thank you. My name is Barbara Chignani, and I'm from Royal Holloway University in London. So I'm actually in the process of designing and validating a Bachelor of Science in Health Studies, which is going to be planetary health focused. So I'm very much interested in what you were saying. But what you were saying as well, Keiko, is very central to how I'm designing that particular degree, because we looked at it as transdisciplinary. And as much as our department is health studies and covers global health, sustainability, biodiversity, culture, etc., we're also going to be working or delivering it at first with the law department and social sciences, as well as geography and other departments within the university. So what I've tried to do in creating this 3-year degree is to take into consideration the fact that, you know, as we're saying, it's transdisciplinary. And so I would be definitely up for sitting with anyone who's interested in discussing this more, so I can show you how I've sort of broken down the modules for the 3 years and what I intend to do. But for those of you who will not be able to sit down and chat about it, one of the key things that we've put in, and I think has to be considered, is that every year there is a placement module which has 30 credits. So whatever has been taught that year that is linked to that has to be practiced somewhere, somehow. So it brings that interdisciplinary aspect and real practice and solution focus. More than anything, the placement is solution focused. So it's one of those things that I suppose, you know, we need to consider. And the challenge, I think, more than anything, has been the idea of planetary health just remaining or being seen or stereotyped as just health. Whereas we've gone away and sort of said health studies, which can be anything. And so it's allowing us to move across the fields without anyone going, what's this planetary health part? So I think it will be interesting to discuss it more with anyone who's interested in developing a full curriculum in this sense. And on that note, tomorrow during the lunch sessions, I do have a side session from 1:15 to 2 in Bray, where I'll be looking at how to create the modules for that and how to put it out. So we're lucky that our university has accepted this degree and it's going to be rolled out. But I'm also looking for collaborations. So yeah, just wanted to share that for those who want to get involved in that.
Just a question. You know, I think I'm just wondering, because I spent all my life in academia, and so I'm just thinking we can roll out just a comment on health studies. One of the things I've learned is that we do a market study to see if it is. We know it's relevant, but I'm wondering if there are not other programs that may already exist. So is it that we really need a program in health studies that deals with issues in planetary health, or to ensure that planetary issues are integrated in curriculums of other programs? I'm just wondering if we'll not be duplicating. Because we have to think at that point, what is the employment opportunity? Because, for example, at my institution, environmental sciences has really taken off. Environmental sciences, and they look at different aspects, environmental and health, you know, environmental engineering, you know, it encompasses geography and climate change, you know, food security, and all of those things are there. So I'm wondering if we're going to take pieces of everything else to create a new career. I think what I really think is important is incorporating planetary in all of the careers so that everybody knows the importance of, so the doctor knows the importance of it, the sociologist, the lawyer, the engineer, and everybody. But if we're just going to isolate somebody there, we're going to go right back to a silo. And then what about the other professions who... So it's just a thought, right? I don't know. I don't mean to, but it's just something I'm thinking about.
So Emmanuel, if I may just, respond to what you're saying. What you have highlighted is a very key thing. So in terms of the way we've looked at it, certainly at our university, we've seen this niche area that people, as we've heard, sometimes curriculums are very difficult to change, especially when you're part of countries that will be heavily the problem. So having something like that rolled across everything might be more bureaucratically difficult, because then they realize, we are the problem, so we're going to be called out on this. So the progress with that becomes much harder. Whereas if it's a discipline that they technically are hoping a lot of people will not be bothered with, then it's somewhere on the side. However, what we are doing with ours, we've rolled it out across the departments, but the intention is once this is fully validated, we are going to create one module which will probably look like what you have done, which is why, I would like to sit down and have a chat. That program, that module, or those couple of sessions will be rolled out across every degree in the university. Just like we have, say, computer skills at the fundamentals, as we have, language skills and all that, we want to ingrain it into the curriculums as part of one of those skills that we need. But for us to do that, as you know, you've got to get a buy-in from the organization. So once you get a buy-in, then it's easier to infiltrate everything else. But what we've found that has made it much easier to get an opportunity to discuss this has been the Sustainable Development Goals. And so what we've done, and I'll be able to show you, we've mapped every module that is lined up to the development goals. So in a way, the university accepts that we're meeting those goals. So this is the one degree that has covered all of them. So there are ways to go around it to sort of entice them.
I just want to say that this is such a wonderful conversation for me, because I am not a doctor. I am a biologist, and I teach in an education department, and I teach about curriculum. And I don't know if you know this, but curriculum comes from the word curricula, that means a way, a trajectory. And a curriculum is a portrait, it's a photography, what are the way we are going. So in each case will be another way. And curriculars are made in wars. It's a war between fields of knowledge. So sometimes we could do this in a country. I know that, for example, Germany are changing all the curricular orientations for all the med schools, but this will not happen in Brazil, because there's more than this is more than changing just the curricular for med schools. It's changing the way of how the Brazilian society see this necessity. So curricular is a way of, if we analyze a curriculum, we will see much of that society. So it's really amazing how we could see, how we see that planetary health goals spreading in Japan, spreading in Brazil, spreading in London, and sometimes it spreads, it's not a great way. Sometimes it's a spread like fungi spreading by the underground and goes, and then it will be in all basic skills. So we need to find the ways, and find the ways of negotiation. I understand what Emmanuel said, that planetary health, and my colleague Neuzair always says this, planetary health is not a field, a concept of one field. So what is the most effective way? Put planetary health in all the disciplines, or put in just one? If we were in the ideal world, maybe this will be in all the disciplines, but see, we will have to fight with all the fields. No, we don't have this strength now. So maybe it's more easy to put in just one integrative discipline, or maybe creating a new optative course or something like this, and this go, 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 and we get more strength. So
there is ways in which you can do it. You can make it an elective, you know, for students. So you have a list of electives, and this can be one. And the other one is to make it a core. You know, in most universities, as I said yesterday, you have to do IT, you have to do history. Also make this a compulsory. So no one graduates until they would have taken this course. You know, that's one way. We make it a core, or you make it an elective. You know, so those are the ways in which we can deal with it. Yeah.
Does anyone want to have a look at the printed versions that hadn't gotten the chance? No? Okay. Here is volume. Huh? Who? Yeah. Yeah.
So I was listening to this debate, which I think is very rich, and I'm adapting a phrase that I heard in one of the sessions that was going on. Someone said that the budget is a moral statement or a moral document, and I was thinking the way she described it, that the curriculum is a moral document. So it's really reflecting how society functions and moral values of the society.
This has been a very rich talk and exchange. I don't know, it would be very nice to keep in touch with you when somehow, I don't know. Yeah. Yeah, I'm gonna pass a list of emails so you can. And I send the emails to everybody? Yeah? Okay. Yeah. Nice. Want to speak? No? What did you say? Oh, thank you.
Congrats on having a master's for such a great project. I like seeing, you know, like, I think it's exciting. Oh, no.
No, please.
I was just saying it's exciting to have your master's work have such a great outcome. You know, you've been building on it, and to see students get excited about learning about this stuff, it's awesome. So congrats on that. Yeah.
Thank you. Okay. So if you just don't go away before. And is anyone in the chat? No? Okay. An article will come also about this. So maybe in the next year I'm able to write it. And I'll send it to you. I think it's over. Just write your email.